Good morning and welcome back to All Nurses. So today we're going to be talking about drug families and drug classes. So what is the difference and why do I even care? Well, a couple of things going on here. So technically there is a difference, but a lot of providers, a lot of nurses aren't going to make that distinction there. So just be aware of that when you're talking to a lot of your doctors, a lot of your nurses, a lot of physician assistants, that it's the same thing in their brain. All right, but technically there should be a difference. So a drug family is basically a broad group of what a drug does. So for example, if I'm lowering blood pressure, it's going to be an antihypertensive. If I'm going to lower the cholesterol, it's going to be anti-lipemic. If I'm going to lower blood sugar, it's going to be a hypoglycemic, right? Now, there's a lot of different ways I can lower my blood pressure and still be in the drug family of an antihypertensive, right? And so with drug classes, I'm telling you how I'm doing it, right? So drug classes are based off the mechanism. Let's look at that antihypertensive. So one of the ways I can lower my blood pressure is block the ACE enzyme, and that's called an ACE inhibitor. All right. Another way I can do it is I can block the beta receptors of the heart. That's going to slow down the heart rate, and that's going to drop my blood pressure. And I could keep going on with these drug classes. So why do I care how this mechanism works? Look, I'm not going to be a pharmacist. I just want to get my degree and start making money. So why on earth do I care? Or I just want to help patients. Why on earth do I care what the drug class is? Well, you should honestly care a lot if you're trying to help your patients, and here's why. Let's say you got a patient, they're on an ACE inhibitor and they're coughing, right? And this has been going on for a while, and the family's kind of concerned, right? Does dad have lung cancer? I mean, he did smoke for a couple of years there. And so you look and you find out, oh, they're on an ACE inhibitor, right? A common side effect of an ACE inhibitor is cough, right? So let's say lisinopril is the medicine that they're taking. Well, if I switch them from lisinopril to captopril, guess what? I'm still an ACE inhibitor. And so guess what? They're probably going to have a cough, right? Man, I don't know why this cough isn't going away. Why? Because you're doing the exact same thing you were doing when you were taking lisinopril. You're just calling it a different name, right? So realistically, you're going to have pretty much all the same baggage you had before. Now, if you switch things and you do things totally different, so instead of blocking the ACE enzyme in the heart, in the lungs, and increasing that bradykinin, which is causing the cough, you're going to block the beta receptors of the heart, right? And the beta receptors of the heart allows it to respond to stress hormones in your system. And so it's going to make your heart beat faster. And so if I block these receptors, what's going to happen? My heart's going to beat slower. And as a result of my heart beating slower, my blood pressure is going to drop. And because I'm not building up that bradykinin, I'm not going to get a cough, right? And so that's why these mechanisms are very, very important. The other thing is it can help us figure out how to best treat the patient. As I said, they're having side effects. You want to switch them to a different drug class. But some drug classes work together synergistically. Well, what's that? 1 + 1 = 4 or 8, right? So in order to be synergism, it has to be 1 + 1 = at least 8 or more, right? 4 times what you expect from simple addition. And so what's going to happen here is, let's say you put you on a diuretic. This is a medication that makes you pee out extra fluid. Well, your body doesn't want to have a low blood pressure, and so your heart's going to beat faster, right? Well, if I put you on a beta blocker, the way that works is it slows down your heart rate. So those two together are going to have a much stronger impact on your blood pressure than put you on an ACE inhibitor and an ARB. Why? Because an ACE and an ARB are kind of treating the same pathway, right? It's kind of like I don't like somebody, and so what I'm going to do is I'm going to cut their brakes. Okay, and so what happens when they step on the brake pedal? The brakes don't work. So let's say I really don't like somebody and I take off the brakes. Well, that's not going to make much more of an impact on their chance of getting a car accident. The brakes already don't work. So because I cut the brake line, so taking off the brake pedal really isn't going to add much to the situation, right? But if instead of taking off the brakes, I also cut the, let's say the cables for the steering wheel, now they can't turn the car right or left, and the brakes don't work, that's going to have a much bigger impact on the chance of getting in a car accident than removing those brake pedals.